Your kidneys are two vital bean-shaped organs inside your body. They are responsible for numerous essential functions. By now, almost everyone knows that the kidneys filter blood and form urine as a result. This prevents toxins and waste products from accumulating in your body. But did you also know that your kidneys have other functions related to your blood? The kidneys also play a role in regulating your blood pressure and forming new red blood cells. They also balance out the levels of acid and bases in your blood. All this helps all your other organs function properly. Without the kidneys, your whole body won't function well, and you won't be able to survive. Do you see now how important your kidneys are? This is why you should never ignore any cry for help from your kidneys, because kidney diseases are no joke. In very severe cases, a person with renal failure must undergo weekly dialysis 3 times a week or get a kidney transplant. Both will completely alter the course of their life. So in this video, we will reveal to you 12 alarming signs your kidneys may be in danger. So, without any further ado, let's get to it. Number 1. Swelling. If you notice swelling in your body, you should start suspecting kidney diseases. You see, your kidneys are tasked to remove excess fluid from the blood and excrete it as urine. When the kidneys aren't doing their function properly, they can't remove this excess fluid as it should. So this fluid accumulates in various parts of the body, leading to swelling, particularly in the legs, ankles, feet, and sometimes the hands and face. This is made even worse by the failure of diseased kidneys to remove sodium from your body. If sodium stays in your body in significant amounts, it'll attract water and lock it in your body. This will consequently cause your body to swell. Number 2. Fatigue. Do you feel fatigue all the time? Contrary to what has been normalized nowadays, constant fatigue all day isn't normal. In fact, it could be a sign of kidney dysfunction, especially if combined with the other symptoms from this video. Remember how we mentioned earlier that your kidneys play a role in the production of new red blood cells? Well, they do this by producing a hormone called erythropoietin. This hormone stimulates the bone marrow to produce new red blood cells. But if the kidneys are damaged, they will produce less erythropoietin, leading to fewer red blood cells. Low red blood cell count is famously known as anemia. Red blood cells are important for carrying and then delivering oxygen to your body cells. Oxygen is needed by our cells to produce energy. When there aren't enough red blood cells, the body's tissues and organs won't get enough oxygen, so they'll have less energy. In the end, this will lead to feelings of fatigue and generalized weakness. Number 3. Changes in urine. Changes in urine appearance are a huge indicator for kidney disease. Are you noticing an increase or decrease in urine amount? Moreover, pay attention to any changes in color. Did your urine recently become foamy? Well, this could show the presence of proteins in your urine in considerable amounts, which isn't normal, and can indicate problems with your kidneys. Is your urine pink, red, or cola-colored? All these colors reflect the presence of blood in urine. The color intensity varies according to the amount of blood, where urine with little blood can appear pink and urine with significant amounts of blood can appear cola-colored. Furthermore, any changes in your urination habits can be a sign of kidney disease. For instance, you should always check with your doctor if you have increased urination at night, or if you've been feeling pain during urination, which can be a sign of a urinary tract infection or kidney stones. Bear in mind that some medications you can take or food you eat, or even the amount of water you drink throughout the day can cause temporary changes in urine. However, it's better to be safer than sorry, don't you think? Number 4. Shortness of breath. Are you experiencing shortness of breath? Shortness of breath is when you're breathing rapid and shallow breaths, and it feels as if you're not getting enough air. But how is your breathing related to your kidneys? Well, when kidneys aren't functioning properly, they may not be able to remove excess fluid from the body. This fluid can accumulate in the lungs, which is known as pulmonary edema. If there's fluid around your lung, it'll be harder for your lung to expand upon inspiration, making it difficult for you to breathe. Number 5. Skin rashes and itching. Skin rashes and itching are quite uncomfortable for everyone. But did you know, though, that they can be related to a kidney condition? The accumulation of toxins that were normally removed by your kidneys are one of the main causes. One of these toxins is urea, which is normally excreted in urine and gives it its smell. If urea isn't filtered from your blood, it'll accumulate and cause a condition called uremia. Skin rashes and itching are prominent signs for uremia and thus signs for kidney disease. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 6. Metallic taste in mouth. Does it feel like you have a metal spoon stuck to your tongue? Having a metallic taste in your mouth can be your kidney's way of telling you to get it checked out. In addition to skin rashes and itching, that metallic taste in your mouth can be another sign for uremia. You see, the accumulated urea can reach your mouth and break down to form ammonia in your saliva. As this saliva spreads in your mouth, you'll feel that metallic taste. This may also alter the way you taste food or drinks. Number 7. Nausea and vomiting. If you feel nauseous and want to vomit most of the time, then your kidneys may not be okay. Urine that accumulates due to the failure of the kidneys to remove it can be held accountable in this case too. You see, as urea accumulates, it can lead to inflammation and irritation of the digestive tract, leading to symptoms like nausea and vomiting. Other causes for nausea and vomiting due to kidney failure are decreased erythropoietin hormone and anemia. Number 8. Feeling cold. Feeling cold can be a sign of kidney disease, as it's usually a consequence of anemia. Normally, your body uses oxygen to produce energy that can be used to warm the body up. But as the kidney struggles to produce erythropoietin, there will be less red blood cells and oxygen in the blood. In this case, your body cells won't be able to generate adequate amounts of heat using energy in food because oxygen was a key player in this process. Number 9. Dizziness and trouble concentrating. If you're having trouble concentrating at the task at hand, maybe you should stop being too hard on yourself and get your kidneys checked. This is because dizziness and trouble concentrating can indicate kidney disease. This can be attributed to anemia because as less oxygen reaches your brain, the worse it'll function. Number 10. High blood pressure. Your doctor may refer to your high blood pressure as hypertension. When dealing with injured kidneys, the excess sodium and fluid that accumulates in your blood vessels can increase your blood pressure. Additionally, kidney disease can lead to narrowing of the arteries that supply blood to the kidneys, which is a condition called renal artery stenosis. This narrowing can decrease blood flow to the kidneys. Your kidneys will interpret this decrease in blood flow as a decrease in blood pressure, and so they will release hormones that raise blood pressure. Number 11. Back pain. Your kidneys are located in the lower back region, just below the ribcage. This is why lower back pain can be an exceptionally strong indicator for kidney diseases. This pain occurs either due to infection, inflammation, or swelling. Number 12. Puffy eyes. Persistent puffiness around the eyes can be due to the kidney's negative affection. Puffy eyes can be a symptom of kidney disease due to a condition called nephrotic syndrome. Nephrotic syndrome occurs when the kidneys leak enormous amounts of protein into the urine instead of keeping it in the body. This is due to the damage of the sieve-like structure of the kidney that's supposed to catch those proteins and prevent their loss in urine. As these proteins get lost in the urine, the levels of protein in the blood decrease. Albumin is a blood plasma protein that plays a vital role in maintaining fluid balance within the blood vessels. When albumin levels drops, fluid can leak out of the blood vessels and accumulate in the body's tissues, leading to swelling, specifically in areas with loose skin, such as around the eyes and in the ankles and feet. So these were the 12 signs your kidneys may be in danger. So have you ever battled a kidney disease before? If you said yes, then how many of these symptoms did you have? Share your experiences with us in the comments below. Thank you for watching.